Hi, welcome to our most recent Tush Talk. Today we'll be talking about the role of physical activity before, during, and after treatment. We have the pleasure of being joined by two individuals from Hope and Cope. Anh Thy Le Quang, who is a kinesiologist specializing in cancer prehabilitation and rehabilitation for surgery and other treatments, as well as Nadia Smirnow, who is a physiotherapist and certified lymphedema therapist with Hope and Cope. Thank you guys for joining us.
Let's just go right ahead. So, as you said, I'm a kinesiologist, and that means for those who don't know, I'm an exercise and conditioning specialist. So, my top recommendation for anyone that has just been diagnosed with colorectal cancer is to just get moving and as soon as they can. Okay, we want to avoid inactivity. Now, in the case where you're a candidate for surgery, it's strongly recommended for you to exercise. Okay. So let's say we all have a marathon to run. Okay. Technically, we could all run it tomorrow if we wanted to, but we would likely perform much better if we put time into our training, right? So it's the same for surgery. Clinically speaking, patients who are more fit are more likely to have a speedy recovery after surgery. And that's because we have to see surgery as a huge physiological stress to your body. Okay. And exercise actually has the ability to also cause that stress to your body. Now, let's say you've been exercising for a few weeks. At this point, your organs and your tissues have adapted, and they're likely to be better equipped to withstand the stress of surgery itself. So, surgery really is like a marathon, so it's best to prepare your body for it. And this process is called prehabilitation. Healthy lifestyle habits can really take you a long way. So, taking care of your mind and your body through good nutrition, taking care of your mental health, and of course, exercising is very, very important before surgery and throughout your cancer journey. So, for now, let's just focus on the exercise, right? Um, Now, I wanted to talk about the guidelines. So, per week, okay, the American College of Sports Medicine dictates that we should be doing 150 to 300 minutes of moderate exercise or 75 to 150 minutes of vigorous exercise. So all that is per week. Maybe, moderate and vigorous doesn't mean much to you. So here are some examples. Moderate is like brisk walking, water aerobics, or cycling on a flat path. It's something that you feel is exerting you, but you should be able to talk at the same time. Whereas vigorous intensity is something that's much intensive. Okay, so it would be more difficult for you to speak at the same time. So that would be the most optimal volume of exercise that you should be doing. Now I spoke about cardio, and now I'm going to talk a little bit more about strength training.
I'm going to
Um,
interrupt you just 2 seconds.
yeah,
If I'm a patient that's tired and my energy level is intermediate, intercut, can I cut that 150 minutes into small chunks? Would it have the same effects if I do
of
10
course.
minutes, 15 minutes at a time?
So because these guidelines are per week, of course, this is not like a continuous thing. So as long as during the week you're able to implement that amount of time, then that's great. If you do 5-minute bouts, 10-minute bouts, they all count. Okay, it's cumulative. But at the same time, and we will touch base on this, it's a lot of minutes at the end of the week. Okay. So we will talk about energy management in a few minutes. Nadia will cover that. But I just wanted to go over the general guidelines. So that's a great question. Now for the strengthening, I the recommendation is for you to exercise your muscles at least twice per week, okay, on 2 different days, and to target all of your major muscle groups. So this when I talk about strengthening, we always picture the gym and big weights. It's not that. It doesn't need to be that. It could be weightlifting, but it could be resistance bands. It could be your body weight. Okay. It could be other activities that are not even exercise, like working in your garden. Maybe not during the winter time, but shoveling snow. That could be something that counts towards strengthening. Okay. So I wanted to touch base on tips for after the surgery, right? Because everything I said is kind of general leading up to your surgery date. But afterwards, the top tips that I have for patients is to avoid prolonged periods of physical inactivity. So that means during your rest time, try not to stay lying down for hours or seated for hours. Try to have the habit to stand, walk around in your house, maybe grab a glass of water, go to the washroom, water your plants. Okay. The point is that you want to get up and move as many times as you can during the day. Um, so that's something that is really would contribute highly to your recovery. Okay. Another thing, if after your surgery you have an ostomy bag, okay, there's specific things that you have to look out for if you are to exercise. Okay. First, be sure to avoid your bag before your exercise if possible. Okay. Avoid holding your breath during exercise. So you want to make sure that you have nice flow when you move. And just in general, it would be best to consult a kinesiologist like myself or a physio like Nadia for more guidance. Okay. What movements can you do? What's contraindicated? What's not recommended? What is recommended? There are some very specific things if you have an ostomy bag. So just to see what can be done with a specialist.
All right, so I'm gonna start by talking about some of the side effects that we often see because of treatments, because of side effects of treatments that can be during your treatments or even persist afterwards. So, some of the ones that we can see in the short term, fatigue is a huge one. I mean, that can be involved with surgery, with chemotherapy, and with radiation. There's sometimes nausea. Something that we can have after chemotherapy is something called peripheral neuropathy, where you feel some pins and needles or tingling, oftentimes fingertips, toes, and it can extend to sometimes the whole foot and hand. Certain treatments also impair how your body collects oxygen. So it can decrease your hemoglobin that collects and carries your oxygen throughout the body. It's known sometimes that some treatments will cause some muscle wasting and decrease your bone mineral density. And overall, this can decrease your physical capacity and quality of life. So these are
Muscle
all
wasting means that you would lose some of your muscle tone that you've built over the past years.
Exactly. And sometimes it's treatment specific, but oftentimes that happens because, well, we're generally tired during treatment, after surgery, and then, after surgery, I have to get chemotherapy or I have to get radiation. And it's cumulative that we tend to become less active. And so our body doesn't need the muscle anymore and it sees it as fuel. So it just uses up muscle too. So it kind of just leads into this vicious cycle. So we're kind of here to say, hey, wait, maybe there's something that we can do. And, there are some long-term related side effects of treatments. I won't go into too much details, but yeah, there are some treatments or just from being more inactive, from fatigue, from just the cumulative effects of everything, that there are higher rates of obesity and diabetes and cardiovascular disease in cancer patients long-term. So that's definitely something we want to address. So this is a very busy slide, and the only reason I really want to share it is that it's a really important slide. So the American College of Sports Medicine made this roundtable with cancer exercise specialists, and they went through all the data. And they came up with a first guideline in 2009 and updated it in 2019. So this infographic here is based on meta-analyses of all the cancer exercise research that they could find, and really went specific to cancer diagnoses and cancer sites, and as well as specific outcomes, health-related outcomes. And how does exercise have an impact on this? So, busy slide, and I'm going to just break it down in the following slides. So the one thing I did want to mention on the first infographic is that survival rates increase, and this has been proven in breast cancer, prostate, and colorectal cancer. Survival rate increases with physical activity. So that's why we know it's so important to encourage our colorectal cancer patients to have a healthy lifestyle and include some physical activity in it. So why is aerobic exercise important specifically to cancer-related side effects? Well, we know that it has an impact on fatigue, treatment-related fatigue. It has a positive outcome, positive correlation with health-related quality of life and physical function. And it can often help with symptoms of anxiety and depression. So when we look at dosage, the recommendations are generally 3 times a week, between 30 to 60 minutes per session, and moderate to vigorous intensity. Now, Karine, what you mentioned before is some people just can't do it, and we're going to kind of go more into details about that. These are the recommendations. It doesn't mean that if I can't do that, I'm not going to do anything at all, right? If your gas tank needs to put gas because you're running on empty, but you don't have enough money to fill the tank, that doesn't mean you're not going to put $5 in to get you a little further, right?
Little bites.
Little bites. So moderate to vigorous activity, what does that mean? So Auntie already talked a bit about, talk test and that how you feel. Moderate intensity should be something you're able to have a conversation. You're going to take breaks every few words, though. Like you can't just have a full-on long conversation without kind of getting some air. Another way we can do it, the modified Borg scale is from 0 to 10, easy for patients to remember. So you want to be in an intensity level of between 3 and 6 to really get that good amount, that good intensity. So those are 2 different tests that we use with patients for them to figure out what intensity they should be working at. So when we speak about resistance exercise, the data is pretty clear on that too. It does help with fatigue. It does increase health-related quality of life and physical function, and it can also help with bone health, so strengthening bones. And to get the benefits, the recommendation is twice a week. And for most people, they can do 2 sets of between 8 and 15 repetitions per exercise. So that means I would be doing 1 exercise, repeating that 8 to 15 reps, take a break, do it again. That would be your 2 sets.
What is a good example of resistance exercise?
Yeah.
Like just to give us context of what that means.
Sure. So a resistance exercise, one that I really enjoy giving, and because it's such a functional thing, is a squat. So
Okay.
A squat is standing up, bending down. Now, why is it important? Well, we do squats all day long. We sit on a chair, we stand back up. We go to the washroom, we have to get back up. So for all of our patients, that is just a fundamental movement that our body needs to be able to do. And the added benefit to that one is that it uses a lot of muscle groups and a lot of big ones. So you get a lot of bang for your buck there.
And you don't necessarily need additional equipment to be able to do it either.
Not at all. Not at all. If you feel like it's really easy, if you think that you're doing 8 to 15 reps of body weight squats and you can probably do 30, then that's time to upgrade and say, okay, how can I make this a bit harder? Because that's how our body builds. We have to stress it, not here. We have to stress it just enough for the body to get a stimulus and to say, ooh, okay, they need me to be a bit stronger. How can I do that? Oh, well, and then that's how we build up strength. We don't go from here to there, right? We don't run our marathon without training. Same idea. Yeah. So when we spoke about fatigue, it's probably the most common side effect that I see with most of my patients, especially when they're in treatment. So what do? Well, if I'm tired, if I do nothing, if I'm tired, I'm going to sleep more, I'm going to be less active, and then I'm going to continue that cycle. And it's a vicious cycle of fatigue where my body gets more and more deconditioned. And then I ask my body to do the same thing that I asked it a month ago, and it's strenuous. It takes a lot more effort. Then I'm going to do even less, right? So we're trying to avoid our patients getting into that vicious cycle of fatigue and deconditioning. It's tricky because exercise is like a medication. We have to find the proper dosage, right? If you don't do enough, you don't get any therapeutic value. If you do too much, you can get a lot of side effects. So, we always talk about finding the proper dosage, and the proper dosage can change from person to person, absolutely, but also within our own selves, from depending on how we feel, depending on where we are in our treatment cycle, depending on so many factors. Did I sleep well? Did I eat properly? How is my stress level? All of this kind of feeds in together. So yes, we have to listen to them. And if they are tired, we could say, maybe today's a rest day. But it's tricky when we're in this cycle of fatigue. Is my body actually tired? Or if I would try to move my body, maybe I'll get more oxygen. Maybe I'm going to feel actually better, and maybe I might sleep better too. Right? So my first recommendation to them is, can you get out of bed? Like, if you have to stay in bed all day, that's fine, right? We just say, tomorrow's another day. What I use on myself is what I'll generally say is, I use the 5-minute rule. Sometimes I get home from work, I'm tired, you don't really want to go through, oh my gosh, I have to do a workout. 5-minute rule. So first things first, like, you get dressed in your workout gear. Take as much time as you need, but at least you're setting yourself up for success. Then it's, okay, 5 minutes. I'm going to do a 5-minute warm up. I'm going to put my timer on, and I'm going to check in with myself and really, really check in and say, okay, body, like, how are you feeling? Am I feeling worse than I was 5 minutes ago, or am I actually feeling a bit better? More often than not, you're like, well, I'm already dressed. I'm already started something. And okay, I think I can get through a small workout, or I can get through some workout, right? And so that's how we can kind of build on that strategy.
And you can continue to add on to that 5 minutes, and then recheck in with yourself at another 5-10 minutes and see how you're doing as well.
Exactly. There's no, like, yes, we give guidelines, but there's no like strict rule here. The body wants to move, right? That's it. The body feels better when it moves, but we have to allow it. Maybe today is not that day. Maybe we always have to gauge, and it's something that you develop. It's like anything else, the more you practice it, the easier it gets. So the more you practice checking in with your body and really understanding how you feel, the easier it will be to connect with that sensation, right? So that's one thing for the energy. The other thing is, well, oftentimes when you're in treatment, it's cyclical, our energy, right? So some days after treatment, there's a down, and then after a few days, I'm back up, and then, oh my gosh, I need to do everything all at once. I'm having a good day. I'm going to go do my groceries. I'm going to go buy my kids some clothes. I'm going to go visit my parents. And then you get home and you're drained, right? Like, drained. You have just pulled from your energy for the next 2 days. Okay, so that's kind of where I'm going with the next slide, is that you want to, even if you're having a good day, try to spread out your activities throughout the week. If you know you have really important things to do on really specific dates, write it out, see where your week's going, and see where you can plug in activity in there. If you know you're going to have a crazy day, you have to go for your blood test and meet with your oncologist, and you wait there for 5 hours and all of that, it is an energy drain. To force yourself into exercising that day would be crazy. And so another thing I like to visualize with my patients, or have my patients visualize, is a gas tank. So a gas tank can be full in the morning. More often than not, it's not going to be at full, right? We didn't just go to the gas station and fill it up the night before. So depending on where you are in your gas tank energy reserves, that will guide you as to how much and how you will plan out your day. But always try to remember to keep a quarter tank for the next day, because that at night, that energy is going to be used to fuel you and rest you and make you feel better for the following day and help your energy levels for that day. So that kind of all ties into, when am I exercising? Should I be exercising? It's not a straightforward answer, and it's going to be different for everyone.
It takes some practice too.
And it takes
to figure out what works for you and what doesn't in the energy wise. I think as you experience it, you know, well, this is my limit, and then the next time I won't go to that point. I'll stop a little bit before. Exactly. With experience.
Exactly. Oh, I did all of this and I was knocked out for the rest of the week. Well, good. Now you know. Now you know. Doesn't mean we're going to stop. It means we're going to modify. Test it out. Test out this one, see how you feel. You know, and then it just gets practiced and you get better at it. So the next slide, I want to talk about myelosuppression, which is a fancy word to say that most chemotherapy agents will affect your bone marrow, right? And so it can cause changes in hemoglobin levels, in white blood count levels, and in platelet levels. So those are the 3 different things I write out: anemia, neutropenia, thrombocytopenia. Those are the fancy medical words, but it is low hemoglobin, low white blood count, low platelets. These are important for us to know. It's important for the patient to know while they're exercising, and it's important for the professionals to know so that we can monitor, engage, and modify as needed the type of exercise we recommend. The most important one, I think, when we're talking about exercise, which also feeds into fatigue, is the low hemoglobins.
So low red blood cells.
Low red blood cells, yeah. So if your red blood cells are low, that means that the hemoglobin is low. That means your oxygen transporters in the body are low. Your body needs the same amount of oxygen no matter what, right? Like, it needs a constant supply, which means your heart is going to beat faster because the concentration in blood is lower. So it's working a lot harder at rest to get the oxygen going through your body. So it's a fine line. Sometimes when it's just slightly low, sometimes that can actually help, right? It can help our energy. It can help us be more efficient in our oxygen transportation and usage, and that's great. But there is cutoffs, right? And that there's specific cutoffs for if your doctor will tell you need a transfusion. I mean, that's probably the extreme case. You should not be exercising. You should be lying down and resting. But there's a big variant in there between, you know, no rest at all and what can you do. So again, we're going to go with, how do you feel? Your body will tell you. I mean, if your heart rate is through the roof just walking up the stairs, that's probably enough exercise for today. If you can,
it might be a light stretching day more than
a stretching day. It could be maybe a Tai Chi day or a yoga day. Something that's gentle enough, that's not as physically demanding, but that's still allowing you to move. Most of the time, these 3 are very easy to find on your lab results. So if you're in treatment during chemotherapy, you will be seeing these and your doctor will let you know. For the white blood count, well, if you have low blood count, white blood count, you're at a higher risk of infection. So it changes not so much the type of exercise you're doing, but where you would be doing it. So definitely consider, and most oncologists will say you don't go in a public pool while you're in treatment for that. Most gyms, it's harder to regulate. Our gym is smaller. We still do allow, but it will depend on the level. So it's a case-by-case judgment, and on the patient's comfort level too, right? So there's that. And for the low platelets, well, you have a higher risk of bleeding and bruising. So if you're going to be doing something that's a little more, contact, I don't think many people are playing rugby or football while they're in treatment, but you have to just be aware of, you might bruise, and it might be from something very benign as just like I hit the corner of a machine, and that's going to happen. So just be more aware of your surroundings while you're exercising, and just be more aware of, all of that.
The great part now today with all of these, especially the low white blood count, is there are things that are now available online also that you can have access from home. So if you're unable to go somewhere, you can also participate from home and have that benefit as well.
It's a fantastic tool. And I think one thing of the pandemic that was positive is that there has been like a mushrooming of different online stuff available, which I think is great. And if ever someone isn't sure if they should be doing that video, then they should contact a professional and just see, is this something that would be right for me? Like, I know Auntie and myself would be glad to assist for that kind of stuff. Okay, so the other side effect of treatment that we kind of spoke about earlier was peripheral neuropathy. So that pins and needles, that tingling that can happen with certain chemo agents, specifically the ones that are platinum-based or taxane-based, which often colorectal patients will get. So in terms of treatment, that's tricky. So we don't really have a treatment for neuropathy. What we do know is desensitization has been something used in different types of neuropathies. So diabetic neuropathies and some other neuropathies in pediatrics. There's not a lot of studies done. There's basically no studies done in cancer populations to see the effect. But what I can say is it cannot hurt, right? So if you would like to try it, there are certain things that can be done. And it's mostly useful if you started very early on. If you've been living with neuropathy for 6 months, it's going to be harder to kind of elicit some kind of change. So what is desensitization? It's confusing the brain of sensations in that area. So there's different ways of doing it. So contrast bath would be having, some hot, not too hot, but hot water and cold or ice water, and you would alternate a minute, repeat that a few times. So you can, one theory is that you're flushing the area out of toxins. The other thing is just for that sensation. There's extreme sensations, and we're trying to confuse the brain, that signaling. The other one that I often will recommend is alternating soft and rugged fabrics. So take a silk cloth and then grab something like, a carpet or something, especially for the feet. So you something really soft and just rub your feet. I'll use feet as an example. Rub your feet for about a minute or two, and then switch over to the carpet that's a little rougher and do that for a minute or two. Repeat that for about 10 minutes every day. And it's just helping, again, mix up that nerve signaling. Does it work? I honestly can't say yes or no. It's a very long-term thing. And
not enough research yet, but like you said, there's no negative effect. As long as you're going within your comfort zone, there's no negative effect.
Exactly. And one thing with certain chemos, they say, cold is not necessarily tolerated. So then I would say no contrast bath if you know that your chemo is doing that to you. In terms of exercise safety with neuropathy, it's safe. It's safe. we might need to make some adjustments. We might need to change the grips on certain things, widen the, like for holding on to weights, prioritize machines versus handheld weights sometimes to allow for that grip and safety. And we might need to change the positioning. So instead of a standing exercise, we might do it seated. And one thing that we will check on most of our patients, but specifically if we know you're on chemo, is that we're going to check your balance and your gait. Because if you have altered sensation in your feet, it can definitely affect both of those. And well, we don't want you to fall, so we're gonna make sure that that becomes an important part of your training.
But by exercising with a professional, can I improve that balance and that gait when I'm...
Absolutely. Yeah. So the more you practice it, the faster that signaling comes to the brain. So movement, sensation, all of that is a signal, right? It goes through a nerve to your brain, gives feedback, and then the muscle reacts. So when we're working on balance, that's exactly what we're doing. We're trying to get it unsteady and getting your brain to react quickly to reposition. Same thing with gait. We can always practice it. Okay. Last thing I wanted to mention, not everyone has this, but it's an important part of what we do. And it's something we have to factor in when we're choosing exercises for our patients. So if because of certain treatments that can decrease bone density, or if you are already diagnosed with advanced cancer and there are bone metastases, it's exercise is very important, but also it has to be very specific, very specialized. So first things first, medical authorization is definitely needed. Your doctor and your medical team have to be on board. Meeting with a specialized kinesiologist or physiotherapist is really important in this case to really make sure that we're giving safe exercises and that we can have regular follow-ups. And definitely one of the issues that we're going to work on is fall prevention. So really working on that balance and working on all of that, because falls can lead to fractures. So that's something we want to avoid. And there's certain movements and certain activities that we don't recommend. So we want to avoid high impact loads, hyperflexion, hyperextension in our spine. If we do flexion or extension in our trunk, we want to not add resistance. And any quick dynamic twisting motions should be limited. I'm going to hand it back off to Auntie.
Yes. So I think what we can take away from the combined information that Nadia and I provided today is that in theory, there's some guidelines. There's some fixed things that the scientific community has agreed on. But in practice, okay, Nadia and I can tell you that it's not necessarily easy to implement 150 to 300 minutes of exercise per week. There's so many things that get in the way. So let's say today a patient has decided, okay, I want to try to exercise. I want to try to integrate this into my weekly program. The first thing to do is to speak to your doctor, okay? Specifically for if you want to come exercise with us at Hope and Cope, we would need a consultation and a medical authorization, essentially. So once that's done, a consultation can be done with us. After that, we have to determine the level of energy that you have, okay? What is the level of energy we're working with? What is the general physical capacity? And we have to respect that. Okay, we don't want to overtrain either. Okay, we're going to set goals. What are the short-term goals? What are the long-term goals? And then find out what type of activities that you like. If you hate walking on a treadmill, we won't put you on a treadmill. If you really like the stationary bike, then you should definitely do that. Okay, it should be fun and enjoyable, and you should not feel like a chore or something that you're forced to do. Okay, so this is the thing. The hard part in exercising is to tell yourself, you feel forced. Okay, if you tell yourself, well, I have to exercise, I have to do it, I have to do 300 minutes per week, then it's going to be really difficult to get started. Okay, so it's a little bit like the 5-minute rule that Nadia was talking about earlier. Let's just get dressed first. Let's get dressed and let's start with 5 minutes. And like Nadia said, once you get started, usually we start realizing, hey, you know, I can do this. Let's do a little bit more, and let's do a little bit more. And this can be done both at home, but it could also be done in a gym with the supervision from kinesiologists and physios. You know, we're just here to help through the process, and eventually you'll be able to be autonomous working through this process. So a little bit goes a long way. Even if these big numbers scare you, 5 minutes is more than enough if that's what your energy is allowing you to do. So very often people wonder, well, what if I fall off the exercise wagon? What if I was on a roll and now, you know, it's been a full week and I haven't done anything. What do I do now? Well, first of all, we just want you to skip the guilt. It's okay. Okay. You have to recognize that it's okay not to be 100% all the time, and you have to show empathy and patience towards yourself. Okay. After that, you have to realize that it's what you're going to do onwards. Let's restart. Let's go again and start with our getting dressed, 5-minute rule, and so on. Usually people will get right back on track. Okay. And it's always taking it one day at a time. We can't really anticipate how we're going to feel, especially with treatment. So we have to be patient with ourselves. We have to be intuitive and take it one day at a time. It's as simple as that. So this is just a summary slide. You know, we talked a lot about a lot of things, but exercise has a whole lot of health benefits, okay? From maintaining body weight, better physical capacity, post-treatment recovery, a recurrence risk reduction, chronic disease risk reduction, and overall better quality of life. So if exercise is something that you want to get started with, and we strongly recommend that you come to Hope and Cope. Nadia and I would be more than happy to help out with this process.
So yeah, we are definitely a community resource, and we're open to all cancer patients within the Greater Montreal area, and actually beyond, virtually if needed. But there are other ways of being active. I mean, you can find your local Y or even community centers. Each borough has a community center. Often, if they have pools, they're going to have gyms also. Like you mentioned before, I mean, surfing on the web, YouTube has all kinds of different activities that you can follow, exercise programs. So we are part of the community resources at Hope and Cope. So we're located a block away from the Jewish General Hospital on Côte St. Catherine. All of our services are free for cancer patients. Typically, we see patients up until 2 years from diagnosis, although if there is an advanced cancer, then we will still see them throughout the cancer journey. And specifically to our cancer and exercise and rehab program, we can give virtual consultations, in-person training in our gym, and we offer group classes. There's Qigong, there's Tai Chi, there's yoga, there's Latin dance, and there's straightening classes as well. And these are our contact informations for both of us if anyone ever needed to send us a question, or if they wanted to come and get a consult, we can guide them how to do that step by step. And
Thank you incredibly for having been here today with us and for offering such amazing services to the community. I know that patients truly enjoy going to Hope and Cope and all the different services that are available, and truly find a benefit from the exercise, and just having you guys around and helping them with those tough days and those tough questions, and just having a helping hand to guide them through.
Thank you for having us and to help spread the word.